For those caring for loved ones in nursing homes or working on the front lines, have you ever paused to wonder how many emergency visits for terminally ill residents could be gently avoided? A recent study in the Journal of the American Medical Directors Association found that nearly 80% of these urgent trips may not be needed, offering hope for a more peaceful experience. This invites us all, families and professionals alike, to reflect on how we care for our most vulnerable and what gentle changes could truly improve their lives. The study, drawing from the Interventions to Reduce Acute Care Transfers program, reviewed the experiences of over 6,000 residents in 264 nursing homes across the country. It revealed that 34% of these seriously ill individuals were hospitalized, and more than a third of those hospitalizations could have been prevented with the right support. Most striking, 70% of emergency department visits by terminally ill residents, when they weren't admitted, were actually preventable, sparing residents unnecessary stress. Common reasons for these avoidable hospitalizations included urinary tract infections, seizures, low blood pressure, pneumonia, and heart failure, conditions that can often be managed with attentive care. These findings shine a light on meaningful opportunities to improve the quality of care in nursing homes. Dr. Joseph Auslander reminds us that many of these conditions can be managed within nursing homes, using existing guidelines and preventive strategies to keep residents comfortable and safe. This approach not only eases suffering for residents, but also helps reduce unnecessary healthcare costs for families and communities. These are conditions we know how to manage better in nursing homes, Dr. Auslander shared in a press release from Florida Atlantic University. Imagine a world where your loved ones receive compassionate, attentive care that prevents unnecessary hospital transfers and honors their dignity. How might that change their quality of life? And yours? Consider Mary, an elderly resident who often struggled with breathing issues. With a thoughtful care plan and attentive staff, Mary's episodes were managed right in her nursing home, sparing her the distress of emergency room visits. This approach brought Mary comfort and gave her family peace of mind, knowing she was cared for with compassion. Stories like Mary's show the profound difference that effective, empathetic nursing home care can make. But they also remind us to ask, are we doing enough to ensure this level of care is available for every resident, every day? The study's findings are a gentle call to action for healthcare professionals, families, and policymakers to work together for better outcomes. By investing in skilled staff and the right resources, we can transform how we support our terminally ill residents and their families. If you could change one thing about elder care today, what would it be? Your voice matters. Now is the time for all of us to advocate for better systems and stronger support for those who need it most. Together, we can make a difference.